remember that we are highly trained healthcare workers. We sign up to work in healthcare and we see people's joy, devastation, sadness. And the analogy that I use is you can't walk through water and not get wet. My name's Louise Murphy. I'm a clinical nurse consultant and the Bushfire Recovery Co-ordinator in the Shoalhaven region. Up until recently, I was a Principal Nurse Educator for mental health services, and I've taken on a secondment to the Bushfire Recovery Co-ordinator for mental health services. We need to remember that some of our staff in the region were actually impacted by the bushfires. And when COVID hit, I spoke to my colleague Jeff, and we said, what can we do to support the mental health and wellbeing of the staff? And so we developed this program called Stronger Together. So we want to make sure that we can actually get through mentally fit and healthy.
We're just going to head back in now for
in the evacuation centre when the fires really hit, and there was smoke everywhere and sirens. There was this eerie sense of calmness amongst the chaos, but that sense of human resilience and the resilience of the spirit was amazing. All right, okay, let's gather around. We do home visits and we also help people to link into mental health services.
Well, it was actually the afternoon the fire came through here and we thought the school had gone. People standing around looking desolate and worried.
People feel disconnected. They feel quite traumatised, understandably so.
I used to live at Lake Tinjola, so I felt what they were feeling at the time.
They've experienced a lot of the isolation. And I suppose the difficulty that they have is that it's on the back of the bushfires. We now have COVID. It's a double whammy for that community. And so it does take time for healing and recovery. And just them coming together as a group is actually, healing in itself.
So this is where the grass fire came raging through. Louise has an extraordinarily rich background. To have that kind of expertise, to have the well-being, mental health dimension, and just to work with people wherever they're at. I think the word fabulous covers it.
Mental health support line, Louise speaking, can I help you? So we established a bushfire telephone support line, but we also converted that to the COVID support line for staff. And do you have many supports around you? Do you have other family? We need them to be mentally fit and healthy and resilient so that they can obviously provide exceptional care to the patients and their families and loved ones. So I'm very serious about my own self-care. And I also do a lot of mindfulness and meditation, and I run 3 days a week. That's a good outlet because it allows me to get outside and nature, and it's healing for the soul. I'm proud to be able to stand beside someone when they're suffering and when they're vulnerable, and to be able to hold that space and to be able to, help share in their healing process.